You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Super excited to talk to a friend today. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. Very excited to have a friend and a colleague of mine, Dr. Jess Trimble. Dr. Jess is a Chief Veterinary Officer of Anipanion, a veterinary telehealth platform. After working in general practice, urgent care, and house call setting across Northern California, she started working with veterinary startups in 2016. She now advises veterinary startups in addition to providing telehealth consulting to private practices. When she's not working, Dr. Jess is painting, woodworking, hiking with her dog, reading with her cats, or hanging out with her husband and fellow veterinarian entrepreneur, Dr. Rob Trimble. Jess, welcome to the show. Thank you for finding the time.
Thank you for having me. I'm excited.
I love how you listed your interests. You start with painting, woodworking, then the dog goes on the list, then the cat, and then your husband.
I did that for, oh yeah, that's, good
I'm
reason for
glad you
that.
made the list, though. It's very nice of you.
I considered leaving him off the list actually, but
Yeah,
we won't
well,
tell him that.
no, it's shout out to Rob. So he made the list. This is an achievement. So, Jess, very, very excited to have you here. I know that, your track record with Fuzzy before and with with all the startups, and now with Anipanion. I know you've done some sort of revolutionary changes there and worked with Tony on improving the platform. And I want to dive into. So we had quite a few telehealth platforms, and there's a lot of stuff that's going on right now and has been for the last 5 years. I think that we are finally getting some headway, and I think that veterinarians finally are getting ready to break off their regular flow. I think that even with pandemic, they never changed the whole curbside begin to happen instead of splitting it. And I think that now finally groups and the veterinarians are looking more into, okay, telehealth is not something you insert into regular veterinary day, but you have it separate and augment it with it. Do you see that happening now? Is that how people are applying it? They actually have a separate team that's taking care of telehealth, or is it again something like what's the most common application today when someone wants to sign up for Anipanion and add it to their services?
That's a great question, and I think that's maybe what makes my job so fun is there hasn't really been a common application yet. Like every practice is doing things a little bit differently. We have some that are implementing it from the very beginning of communication to the very end where it's truly embedded into their clinical day, and then we have some where it is like truly separate teams, remote workers, like their own sort of third party teletriage services that they're implementing, and then everything in between. We're dealing with a lot of retired veterinarians that want to provide care back to their old hospitals. We're dealing with some really weird and wild use cases. So I don't think we're at a point where there's a normal at all for telehealth. I think these practices are still very much figuring it out, and will continue to because it's weird out there. Using it for virtual staffing is one of the bigger trends at the moment that we're noticing, and rightfully so, right?
Yeah, I think the whole idea of staff augmentation is like it's a really interesting thing. I mean, we're working on something at Talkatoo, verified by Talkatoo, which is going to be a staff augmentation tool. And it seems to be potentially how this whole area of telehealth may like stay around forever and ever, especially in the veterinary domain. What do you think about that kind of use case, Jess? And like, how interesting is that at Andy Pannion when you're talking to your clients, knowing how overwhelmed a lot of these hospitals are? What do you think of, telehealth staff augmentation? What do you think about people from outside the veterinary world potentially even coming into the veterinary world through telehealth?
I think it's become very quickly one of the biggest drivers. And I'll say when I'm talking to clinics, and they're like, well, we want to use it for this. And I say, have you thought about using it to, help your clinical folks? It's like a light bulb goes off. And most of them say, oh, we do have this great technician that could do this, or we do have this doctor on, maternity leave that could help us with this. And so almost all of them say, like, yes, that's brilliant. We want to do it. So I do think it's going to be a very big part of our future. And it's the only way we're going to survive, right? We're supposed to be short 41,000 veterinarians in the next 7 years. Like, we're not going to survive as a profession if we don't do it.
So I like how Shawn was smooth slipping in his advertising of talking to.
Yeah,
And if you would like to
we
sign
have
up with
to.
the next 5 minutes,
Exactly. Ivan will
please
pay
do
for your
it.
subscription.
I need some coffees, by the way. Okay, I'll do something with Galaxy too. But no, that's
You've
all
done
good.
enough. You've done enough. It's fine.
Really? We should keep the score. Jess, so what's interesting, it does seem like not, the staff augmentation, I think that with the veterinarians, that's for sure. But it does look like that initial influx, I think that sort of filtering who is coming in, who is not coming in, the teletriage aspect
Yep.
seems to be like the first step into determining this. Because I think like now the more I talk to people about this, and as we're designing it at Galaxy, we're seeing that essentially you have the bottleneck in veterinarians, but because the reception has every goddamn animal coming into the hospital. So it's interesting. Do you have any stats on through teletriage how much you can shave off stuff that doesn't have to be in the hospital and occupy our time? Like, is there anything that suggests, look, if you'll implement teletriage prior to coming to the hospital, you probably will take care of X percentage of cases that don't have to be here, therefore opening up capacity to, Y number of appointments.
Yeah, unfortunately, no stats. And that is, I think, one of my biggest frustrations of living in the telehealth world is we just haven't been around long enough as all of these businesses combined, nor does anybody really want to play nicely together and share data. And so there's just no great data sets out there for how this is actually affecting the profession. Saying that, though, anecdotally, we hear it all the time that when we help people understand how to set up this sort of hierarchy of triage, have your front desk folks go first. You have them talk to people, weed out the little stuff, and then it can go to a vet assistant, and then it can go to a technician. And ideally, we wouldn't have veterinarians doing telehealth or telemedicine at all, especially if they can be clinical, because they should be doing surgeries. They should be pulling things out of dogs' stomachs or doing dentals or higher dollar things, and then allowing their techs to do the majority of the telehealth and telemedicine. So, we do have a few hospitals now that are phoneless and say it's the best thing that they've ever done to, be able to triage away all those phone calls.
It's so interesting that you bring that up. So I had a trip to the dentist last week, had some pain, had to go back to the dentist. And so yesterday, I called my dentist 16 times and no one answered. And so I drove there and she was listening to my voicemail as I came in the door. And I was able to get in and get my tooth fixed up and everything was fine. But the telephone is a royal pain in the ass for a lot of veterinary practices. And it's also a royal pain for a lot of consumers, a lot of pet parents. And so let's talk a little bit more about that because I think it's something that's really, really interesting. It seems like without, an army, so like an army of people answering the phone, it's those, and I've run retail businesses in the past, Jess, and there's 3 times a day where there's 17 calls coming in, and then the rest of the day the telephone doesn't ring. So what have you heard from those people that have kind of like got rid of the telephone, and how did that work? This is like revolutionary stuff for our listeners. So double click away. Tell us more.
In general, they say that their sort of hospital relaxation is just so much higher. Without that like constant ringing in the background, they don't have that sort of constant nagging fear of, okay, now what's coming in, now what's happening. And I'm the same with my phone. When I see my phone ring, I'm like, what bad thing is happening now, right? Like my friends text me, I get emails about good stuff. If my phone rings, it's usually because there's like something crazy happening. And a lot of times it's the same in the clinic now that the phone rings because there's a problem. If there's something good happening, it's going to come in a less urgent mode like email or text message or things like that. And so those folks that can get off the phone, they say that their teams are a lot less stressed, but then too, it's obviously more efficient if we can have a to-do list of little chats that a front desk can work off of rather than having to have their brain interrupted and sort of derailed every time the phone rings. They're going to be able to actually finish their tasks and get back to people in a much more efficient manner.
Yeah, it's so interesting. It's actually fascinating to me because I feel like there's this massive opportunity that kind of combines like remote receptionists, remote like smart workers, remote, veterinarians, remote veterinary technicians that can really allow veterinary hospitals to kind of like operate at the maximum level of efficiency and provide the most access to care.
You just pitched Galaxy Vets, man. That's exactly what we are.
I think we need a tally every time a company name is made.
Yeah, no, it's really interesting. And I mean, I think it's a new model of care. And I think like
Yeah.
it's interesting because we don't have the option not to pursue things like this because of the onslaught of demand. I mean, there's no way to get around the demand and supply issue other than figuring out how to get more supply of care. And that could be as simple as somebody answering the phone when a pet parent calls and wants to make an appointment because they don't want to book it through an app or through the website. Like there's still going to be a portion of the population that wants that somebody to say, "Good morning, such and such veterinary clinic." What do you think, Jess? Like, how does this new model look and how's it going to come together?
No, I think you're right. We're always going to have some folks that just can't handle the technology or need that little extra, and that's fine. Some clinics are never going to be able to go phoneless,
Or call their provider 16 times to get an appointment, right? There's always
or
those.
those people. Geez. But I think one thing we're underestimating as a industry as well is how many technicians and veterinarians are out there that aren't clinical that want to provide virtual services. So back in the fuzzy days, I remember there was a point where I was hiring for a mobile veterinarian and I was hiring for a telehealth veterinarian simultaneously. I put my ads up. I think I got one resume over 2 weeks for my mobile spot. I got 36 applications in 12 hours for my telehealth spot. Like veterinarians want to do this so badly. They've left clinical practice for whatever reason, their brains still work great, and they want to still be involved and help their colleagues. So it's sort of a win win situation for the pet, for the clinic, for the veterinarian. It's the best.
It's so interesting because I think if they are supplementing each other, it could actually make clinical practice better, right? So, and not from the perspective of like, oh, clinical practice is now just so awesome, but imagine there's no ringing phone, there's no nagging pet parents, and they've been able to supplement all of these needs with this kind of remote army of people. It seems like it could be the thing that could give veterinary medicine back to the veterinarians, like make it more pleasurable to be in the clinical setting.
I wanted to sort of ask this question because we're all on the same page here. I think we're all saying the same thing, and I think that fuzzy, and I love how you said back in the fuzzy days. It's like a memory. It's back in the fuzzy days, and then the modern animal bond vet. There's a couple other people that are starting to do this, and obviously Galaxy as well. We're doing this, and I think that what again fuzzy modern animal. I'll give them the credit. Started this. This is the Uber of veterinary medicine. This is the Airbnb of veterinary medicine. So I think you're absolutely right, Shawn, that it has to go this way because we're not going to grow 41,000 veterinarians in the next whatever number of years. We need them. But Jess, because you're on the front line with this and you're talking to the vets, what do we need to do to accelerate this? Because it's not going viral yet. I mean, this is sort of it's starting, but what do we need to do to push this? Because this is what's going to change, and the huge part of what I'm trying to do is decrease the burnout in our domain. I think this is the solution to it. Different workflow, augmentation of the staff, letting people to work from home, letting people to switch around. Maybe I love emergency, but I can't do it for a week, so I can do one shift in emergency, one shift online. So, what do you think needs to happen for us to actually make it viral rather than sort of this unique unicorn case?
So, data for me is a big part of it, right? And, I, as a clinically practicing veterinarian, wouldn't pick up a new medication without actually seeing a paper to know that it works. And I think that's where there's a lot of hesitation from some veterinarians is they don't know if it's actually good for their patients or not. There's no good data out there saying, oh, X percent of patients end up, not needing to go to emergency or, whatever data it is they need to feel comfortable. The other thing I think is having our big industry stakeholders all be on the same page because most veterinarians are really looking to the AVMA and AHA and AAVSB and the VVCA for guidance on what they should be thinking and what they should be doing. And none of those industry associations agree with each other right now on what telehealth should look like or what the VCPR should be. It's just a bunch of confusion. And so the veterinarians are like, I'm staying out of it, right? Until the people in charge can figure it out, I'm not going to touch it for fear of my own license liability. I can't blame them.
So can we go there on VCPR? So is there new development in that area? And in any opinion, how much of hand holding and where to go? Like where to go if I want to do this and I'm afraid that I'm going to compromise my license and all of that, where do I go to find the resources if I decided to go to any opinion as a solution? Do you guys provide the information, the guidelines? Where's the best place to go to actually say, okay, we can do it. Right now, it's allowed within these guardrails, but these are the guardrails.
Yeah, so the first answer is yes, we help them a lot. And that's probably my favorite part of my job is to have these veterinary clinics go, okay, so I think I can do this and say, well, actually, looking at your practice act, you can do so much more. And so I help them read their practice act and look through it. I've read more practice acts than I ever care to read ever again in my life. But through reading all of those, the big moral of the story is telehealth is fair game. You can do pretty much whatever you want in any state telehealth wise. So, advice and education. And the vast majority of people that want help virtually, it's just telehealth. They're not actually looking for diagnosis or prescription, they're looking for advice and education and guidance. So, when we look at it that way, we can actually serve the majority of the people with the majority of their needs with the majority of the laws that we have right now. However, there is still a few particular states out there that are really trying to make life difficult. There's really no nice way to say it. We have
Name
a few
them.
states that
Name those states.
are
Let's name those
Florida.
states.
Florida drives me nuts, I will be honest. We actually had a practice who said that the state board told them that if a board complaint came up and they investigated and saw that telehealth was used, that it would be a check mark against them. Even if telehealth was used properly, the fact that they used it would be considered a check against the case.
That's absurd.
Just crazy. Even though in the Practice Act it says that, it's okay to do it. And California has its own issues with, only allowing telemedicine based on conditions rather than the pet as a whole. And so you can only do telehealth about arthritis if you've ever talked about arthritis before. So there's just a lot of like little weird things that, rightfully so, then freaks people out because they don't know which direction they should be going. Because oftentimes their state boards aren't even necessarily following their own practice acts, like in the case of Florida.
Which is crazy.
We've had many conversations around, this just the legislation not catching up to the state of the world, and laws take a while to get changed and edited, and sometimes it's just kind of shining a light on the laggards or people that are kind of operating as if it's 10 years ago. Sounds like, Jess, that was your flashlight shining on the state of Florida. So that's fine, because I think having the conversations and hopefully, this message getting out there may move us in the right direction. And it's such a fascinating kind of area of veterinary medicine and opportunity. But I wanted to kind of shift gears kind of completely, because we're running out of time, and get you to tell our listeners what you guys do at Anipanion. What are you working on? What's interesting? Why should they be looking into you guys?
Yeah, so I mean, first I'll say I've worked for Anipanion for 2 years now. Oh yeah, 2 years. It is like the most fun job I've ever had in my life. Like actually getting to help a team create software that actually works for veterinary clinics. And then also being able to consult with my colleagues is so much fun. So what we are is a telehealth platform, but we see ourselves more as a virtual communication platform and a way to truly help that pet parent be a little more accountable for what's going on. And so we have a great pet app for our pet owners where they can actually go in and they got access to like 5,000 health articles. They can log their pet's own data, and then that data gets pushed back to the veterinarian. So these veterinarians that are a little, wary about how do I make telehealth decisions when I don't actually have any good medical data, we allow and help our pet parents to log with pictures and timestamps of when certain symptoms happen, different activities are happening. They can manage medications and food back and forth through this app and this platform. And so, really trying to help connect those pieces. And if that pet parent has a question, they can just jump into a telehealth conversation with their clinic. And so, really, we're just trying to help arm the pet parents with more data that will ultimately drive them back to their veterinarian, who's then more comfortable making recommendations because they have good data. On the veterinary side, the platform that we have, it's a communication platform, right? If you want to use it for telehealth and telemedicine, great. If you just want to use it to, get back about refills and diets, you can do that too. But it's, video, it's chat, it's internal team management and comments and everything you would want out of a virtual communication platform for both internal and external communications.
Awesome.
That's great. Well, yeah, I think we've burned through all the time like we always do, Jess. So we've got a couple of questions that we like to ask at the end of every episode. First question is a book, a YouTube, a TED Talk, something that you found inspiring on your journey in both entrepreneurship and veterinary medicine.
So I'm actually going to drop two things here. One, no one ever talks about fiction, and I think it's really important that people read fiction. There's some really interesting studies showing how much better people are at their emotional intelligence and empathy and leadership skills when they read fiction and are able to put themselves in the shoes of somebody else. So fiction can go a long way to help make us all better, more empathetic people. But on the other side, I am reading, it's called Doing Good Better, and it is understanding how we can have more effective altruism. And it's making those decisions based off of logic and not emotion. And, we as veterinarians often try to be helpful, but we make those decisions based off our emotions, and sometimes it doesn't go right. And so it's, examining how to make altruistic decisions in a more responsible way.
That's awesome. And the second question we always ask, who would you suggest as a guest on this podcast?
I'm going to totally cop out on this one and say my husband. And I know it, I actually considered, should I really mention him? Because it's going to seem
He made
like,
the list second time. Can
I
we see him
know.
before the dog and the cat?
I don't know. The dog ranks pretty high up on the list there, but no. Rob is doing some incredible stuff over at Harbor.vet, where he is changing the way that veterinary students can access business education in a way that I really wish that I had this when I was going through veterinary school. So for students, for new grads, and as well as newly graduated veterinarians, and helping them sort of understand that path to clinical ownership and a super safe space, and a place where they can learn and fail and feel good failing, and understanding that that's a normal part of the process. It's a pretty phenomenal program.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.podcast.com. See you next week.